Fear has two meanings: forget everything and run, or face everything and rise. The choice is yours. Good evening and welcome. This is Face the Nation. Our topic of discussion today is COVID-19 or the coronavirus. Joining us this evening on the show is Professor Antiviral, President of the Sri Lanka Medical Association, Dr. Samantha Ananda, spokesperson of the Government Medical Officers Association. Also joining us tonight on the show is Dr. Sajeevan Amarasinghe, Secretary of the Sri Lanka College of Psychiatrists. Also joining us tonight on the show to discuss about the economic impact is Dhananath Fernando, COO of Advocata Institute. Let's start off tonight's show with Professor Indika Karunathilaka, President of the Sri Lanka Medical Association. Professor, the second death was also now reported. What is the current situation right now plaguing Sri Lanka in terms of COVID-19?
Yes, if we are to explain the current status that Sri Lanka is in, internationally there is a classification of 4 stages of disease. Stage 1 is no patients, stage 2 is few patients, stage 3 is patients are being detected in small clusters or groups, maybe families or villages. Stage 4 is the widespread community transmission where everything goes out of control, like what is happening in countries like, say, US or maybe Italy. So currently what we can say is that we are in stage 3. Having said that, I think this is a very crucial situation because now we can see the second wave of infections coming from the first wave of patients who came from other countries, imported cases. Now the patients who are getting the disease from them can be traced. And if we don't keep the current very strict control, then we are at the risk of going into a community transmission. So this is a very, very crucial stage at the moment. And I think so far, Sri Lanka as a country has done authorities, health professionals, doctors, and also the citizens in the country. So far, they have done well. Having said that, we have to be very, very cautious and very vigilant. Not to panic, but vigilant. Now, the current situation, there are this number of patients at the moment, about 117. However, the number of patients that we are seeing today is the infection that has happened about maybe 1 week or 2 weeks before. Because the infection period is about, incubation period is about 6 days on average. So what will happen in another 2 weeks or 1 week's time is different. So what's the current situation? The current situation will be seen in another 1 to 2 weeks' time.
So are you trying to say, Professor, that the numbers may increase in the coming few days, given the fact that Sri Lanka first detected its COVID-19 patient on the 11th of March this year?
Yes, to say that we actually need to do a prediction because at the moment we are telling numbers by testing. But to predict in the future, we need to do statistical modeling or mathematical modeling. At the moment, the Sri Lanka Medical Association, University of Colombo, and the World Health Organization, and also the epidemiology unit of the Ministry of Health, we are working on a mathematical model that is under the leadership of Professor Manoj Veerasinghe and of the Faculty of Medicine, Colombo, and Mr. Nishanta Pereira of the Mathematics Department. So that mathematical model is still, we are working on that, but we can roughly say what could happen in the future. We can think of 3 scenarios. One scenario is that current very strict control happening. There is no leakage into community. People basically strictly adhere to the advices. Other scenario is that the patients are not, people are not adhering. So that also can have different stages. The calculation currently is if there is perfect adherence, probably we can see around about 160 patients in April, around the 3rd week of April. But if the adherence is somewhat lax, we say about 5% lax, then we can see about 250 patients toward the 3rd week of April. However, if the curfew is lifted and people are behaving in a rather irresponsible way, what we call is a 10% lax from the adherence, we might see about 300 to 400 patients towards 3rd week of April. Right. And if it's a very catastrophic situation where people are behaving very irresponsibly, what we call the 25% deviation, the number might even increase up to 1,400. So those are the current projections. But having said that, these are all mathematical projections, and there's a big if. If there are catastrophic situations, all these predictions might change.
Thank you very much, Professor Indi Karunatilaka, President of the Sri Lanka Medical Association. We now move our attention to Dr. Samantha Ananda, spokesperson of the Government Medical Officers Association. Dr. Samantha, when you look at the world, you saw in the United States Tom Hanks, who was a US actor who was infected with COVID-19, being based in Australia, quarantined for 14 days and returning back to the United States. We saw Boris Johnson, who is the Prime Minister of London, saying that he's being infected with COVID-19. Then you saw Prince Charles, who also came out and said he has been infected with COVID-19. Does the public healthcare system in Sri Lanka allow individuals to be named during a situation of a pandemic? Is that allowed? Because it's beneficial for the community at large. Because you now know, Dr. Ananda, that Kalugoil Hospital, 2 wards have been closed, and in Negombo another ward has been closed completely because of non-disclosure by the people who are infected with COVID-19.
Yeah, now it is basically a very practical question that you raised, because this is where the public concern is being focused on. Like the public opinion is to disclose the personals so that public will be aware about the a person who was infected, and they can take precautions by knowing the person and the area. But on the other hand, there are so-called ethical aspects of these kind of situations where you don't you need to maintain the certain ethical aspects of the individual who is affected actually. So we should come to a balance of this. So therefore, it's good that you raise that question, and that is what we are also saying. Like this is a disease of public health concern. So the public comes first, and at the same time we need to secure the ethical aspects of all these things. At the end of the day, what we need to happen is to control this disease, to stop spreading, and to come to a situation where people are safe. Now, if I add something, I don't know whether you can take this graph to a closer view where the people can
Just hold it like that, Professor Dr. Samantha, you can speak, and I'll get the cameraman to zoom into that.
Yeah. So yes. Now these are the predictions done by the Johns Hopkins University in US, and these are the predictions that they have done. If the Sri Lanka current situation remains in the same manner, it will escalate in this manner. That is their predictions based on the statistics. As Professor said, they have considered those statistics, and this is the death rates that can how it will move if these things happen. So this is where the people are concerned of. They are concerned whether the number will go up, whether our lives are secured, whether our health sector can take care of us. And exactly these are the problems that we are also concerned of. Like if the numbers escalate, will it overrun our capacity of the hospitals? And then are we going to face through a situation where Italy is being placed today, or where the America is being facing today? And those are the countries were taken as high tech and well developed countries. Their health systems were outstanding, so called. At that time it was predicted like, but actually what has happened? So these are the public concerns that we have to address of. So therefore the mask, wearing mask, and divulging certain informations to the public has to be discussed broadly, and it should be the public should be well informed about those things. So I think that is why I said it's a good question, and I also believe that it is time to address this issue.
Thank you very much, Dr. Samantha Anand, the spokesperson of the GMOA. We now move our attention to Dr. Sajeevan Amarasinghe, the Secretary of the Sri Lanka College of Psychiatrists. Doctor, interestingly, the number of domestic violence is on the rise now because there is a curfew, because people are indoors because of COVID-19. What is the reason behind this? What is the mentality of the people in terms of the number of domestic violence increasing at present?
I believe I have also seen news reports to that effect. I mean, domestic violence was always there. I mean, it's a multifactorial thing. Under the current situation, a certain amount of anxiety and stress is quite normal, or it's inevitable at this situation. And people are under stress. They're not working. Their income is affected. They have lost their daily routines, and most of them are at home. And there's a lot of fear and anxiety. And so due to this, I hypothesize that many patients, many people at home may be stressed up. And so when you are anxious and stressed, you become irritable. You become irritable, and you get angry for things that you don't get angry before. And that might result in this kind of where families cooped up at home, and that might result in arguments and verbal arguments, and may even lead to violence. But of course, we have to be a little careful, because domestic violence has always been there. There is baseline. So whether it's increased needs to be, we need to really study that. But it is possible, given the situation where, there's a family, the husband and wife and the children, all stressed up and all tensed up. And so it can create conflicts and arguments. In this situation, a certain amount of anxiety is inevitable, and a certain amount of anxiety, I would say, is good. So, see the way the people behave, some people behave, I think certain amount of anxiety is good in this situation. But we need to ensure that the anxiety and the stress does not go overboard, where you are psychologically affected and the person becomes irritable, right? And there are conflicts within the family. And how do we do that is what I would like to explain. I'd like to briefly talk about the principles. One thing is, I think one way we can control the anxieties, I think not to worry about things that are out of our control. Certain things in this situation is out of our control as a layman, ordinary person. So the way the infection is spreading, the way the pandemic is spreading, some of these things are out of our control. So we must concentrate on things that what we can do. What are things in our control? Washing hands or keeping our distance, right? Taking precautions. Those are the things that we can do. The second thing is there's an overload of information, and people are 24 hours on social media, television, and they're always, counting the deaths, counting the mortality, counting the cases, right? And you have CNN with a scoreboard-like thing, right? So this is not productive. Yeah. Especially if you're getting anxious, my advice is, and that's the WHO advice as well, to limit the time you spend on searching up on the internet or on news about the epidemic. Maybe 1 hour or 2 hours a day, right? Or 2 hours in the morning and 2 hours in the afternoon. Limit the time. Third, get your facts right. A lot of myths are flying around, and a lot of myths are flying around, especially in social media, and people are panicking, right? So don't panic about what you see on social media. Get the facts right. Go to a reliable source. Find out what's real. Fourth, I would say, use the leisure time in a productive way. Do some leisure activities. Try to do some exercise even within your house, right? And try to structure the day as much as possible. I can elaborate later. Those are some of the things that I can think of which we can actually control the anxiety and the fear at the moment.
Thank you very much, Dr. Sajeevan Amarasinghe, Secretary of the Sri Lanka College of Psychiatrists. We now move our attention to Dharanath Fernando, Chief Operating Officer of the Advocata Institute. Dharanath, in 2008, let's slide back a little bit. 2008, Sri Lanka lost nearly 90,000 jobs directly or indirectly owing to the global recession in 2008. This pandemic seemed to have affected most businesses at present. Most of the conglomerates in Sri Lanka are affected by COVID-19 because of the curfew imposed, because of the restrictions that have been imposed, and thinking of the betterment of their staff at large. Are we heading towards a recession now, once again?
Shamir, in my opinion, yes, we are heading towards an economic crisis and a recession. And when you look at the COVID-19 battle, what we do, I think we also have to consider, of course, there is nothing more important and valuable than a human life. When you're looking at the human life aspect, there are a couple of angles that you have to take. One is the lives which are directly the focus by media and everyone, which is the COVID-19 patients and the number of deaths and the curve and those who are prone to get COVID-19. That's one side. And also I think we need to measure the other variables. Imagine if because of the situation, if someone is losing the access for an urgent medication, and if they are losing a life or having a secondary impact because of that, currently that piece is slightly absent in our conversation. So that's I would like to bring to the conversation or to the table. And at the same time, there's poverty. And the next vulnerable people in the battle of COVID-19 is the people who are at the absolute poverty levels. I'm talking about absolute poverty. I'll give you one example. I'm working for a volunteer organization, humanitarian organization. So we have a gift a meal program which donates 2,000 rupees per month for a family. And we are getting calls by people saying, "Sir, main salli tika damn mother." And we double the amount this month because it's a serious situation. And I'm talking about 1,500, 2,000 families, including students. But because of the bank closing down of the banks, we couldn't proceed the transaction for the last week. Of course, there is an economic impact when you are taking stringent measures on spreading the virus, and that is necessary. As the medical experts said, that is necessary, and that's the heart of the issue. At the same time, I suggest that we also need to take the count of the impact on the non-COVID patients as well as the most vulnerable, that is the poorest of the poor in this situation as well. In the meantime, if you look at the population statistics, we have about 20 to 25% above 50 age population in Sri Lanka. So they are vulnerable, and they really don't know sometimes how to order an online payment. They are not using WhatsApp. They are not very tech savvy, maybe as our generation. So I think these things has also to be counted. And in terms of a recommendation wise for the government, I think they're doing a commendable job, especially the healthcare sector. But at the same time, on the economic front, I would like to suggest three things that you should not do at this particular moment. One is imposing price controls. I'll explain the reasons in the next round.
Yeah.
And also printing money, because that will have inflation and that will again hit the poorest of the poor. Price controls do the same. And the third thing is having import controls, because that will have again a long-term impact. So that would be my piece of first round advice, and bringing and looking at a helicopter view, because human life, there is nothing more valuable than a human life. But when you say the human life, you have to take a couple of angles on how we are valuing the human life.
Thank you very much, Dhananath Fernando, CEO of Advocate Institute. I open the floor for questions from our journalists. Onto my immediate left is Nadim Majid, who attended the Royal Thomi and stayed in self-quarantine for 14 days. And onto my far left is Shehan Ranatunga. So let's start off tonight's show with Shehan.
Thanks, Shamir. If I can pose my first question to Professor Karunathilaka. Professor, referring to something you spoke about, you were talking about stage 4 and the community spread,
community spread
stage. And that is also very popularly referred to right now in social media, for example, as like the second wave.
Yes.
And everybody is dreading this second wave. My first question is that inevitable? How controllable is that? Is it a certainty? And where do we stand in that regard?
Yeah, it depends on the control that we exert. First, let me what is meant by community spread. As I have mentioned previously, there are 4 stages. What we mean by community spread is then the spread becomes uncontrollable. The technical definition of community spread is you cannot trace from where the patient has got the disease. At the moment, generally almost all the patients, their contacts can be traced. So if you cannot trace the contact, what it means is that the infection has become, the spread has become uncontrollable. That is where the danger is, because generally the virus can spread. If you take the incubation period, the mean period is around 6 days generally in Sri Lanka and worldwide. The range is from few days to 2 weeks generally, but the mean period is 6 days. And one person infected with the virus can spread to about 2 to 5 people. So if you put these things together, generally worldwide what is happening is the number of patients are doubling in every 3 or 4 days. That is if you allow this uncontrolled transmission at the community level. And that can be very catastrophic, because you can start with 200, but in next 4 days it can be 400, 800, 1000, and going 2000, and in few cycles it can engulf the whole country. That is what has happened in countries like Italy, because it has gone beyond the control, gone into community transmission, and then it has become catastrophic. It's beyond the control. And when you go into that level, no health system in the world can cope up with that. No curative system. How many ICU beds that we have? You cannot. Now people talk about 500 ICU beds in Sri Lanka. But if we get to a situation that we need 500 ICU patients, then we are talking about a situation about 10,000 patients in the community and about 100,000 quarantined. That's a situation that we cannot control. By that time, everything will go into a catastrophe.
No, I want to interrupt you for a second here and quickly move to Dr. Samantha. Are you in agreement with Professor Karunatilaka's analogy or statistical model that he presented, saying if there are 500 beds in Sri Lanka, 10,000 plus individuals should be infected and over 100,000 people should be in self-quarantine. Is that right?
Yeah, actually, Professor calculated those things based on the international figures, because 5% of the patients goes into the critical phase, I mean the critical level. So based on that, if the bed number is 500, the number of patients should be 10,000. That is, I think it's exactly. very correct international with the international figures. So statistically it is correct, but the problem is the number of identified patients are the number of real patients in the community. That is where the problem is.
No, but the problem, Dr. Samantha, is now let's take there are 500 ICU beds in Sri Lanka. Just let's hypothetically assume that the figure stands at 500. Out of this 500, there will be critical patients who have heart ailments, who have hypertension, who have strokes, and so on and so forth. So from this 500, a certain section should be allocated to them.
Definitely.
And then the rest will be allocated for COVID-19 patients. So this will be far lesser than 500. Am I right to come into that conclusion?
I'll give you the exact figures. With very close figures. Like we have 618 ICU beds, I mean the ventilators at the moment in Sri Lanka, but only 581 is working condition. So now GMO has started a preparing process with collaboration with the Navy to repair the rest of the ICU beds, I mean the ventilators. And there is a process going on from the health minister's side to purchase new ventilators from outside. The problem is it is not available even in the international market. And of course now we are trying to speak to the Defense Ministry and trying to get the KDU help, because KDU has a huge capacity of ICU beds. So if you take all of these, we will be able to get somewhere around 700 to 750 ICU beds.
No, but there are only 30 beds at KDU.
48 beds are there, but they are in the capacity of increasing it to 75 to 100 beds. So, and there is a process going on to produce locally. I don't know how far it will be success, the ventilators, but somehow WHO is helping us at the moment. So with all these things, I think we can go, increase the capacity in KDU to 75 to 100.
But why isn't the KDU hospital in this equation, is there any political involvement, Dr. Sananda? Because you're trying to figure out, even a few days ago when I posed this question to you on the news, subsequently I was wondering, why isn't the KDU being brought into this equation? Is there any political involvement?
It's like this now, when this corona scenario came into the limelight in Sri Lanka, the health ministry started identifying the hospitals that can be acquired. Like first they identify the IDH as the center of the COVID management, but the problem was there was only 4 ICU beds at the beginning, which has increased to 10 at the moment. And then they look for the other hospitals, where now 24 hospitals has been identified as corona management centers. And beyond that, now we are exploring the possibilities. If in case the numbers goes high, the number of critical patients will also increase. Therefore, we are probing the possibilities, and KDU is one of the options. True that KDU is not under the health ministry, it is under the defense ministry. So there are certain protocols and procedures has to be adapted. So discussions are going on. I don't think that there is a political influence on these things, and if at all, even if political influences, it should be a government from the government side, isn't it? So this is the government responsibility to take care of the corona and control it. So I don't think that they will hesitate to give it, So
Professor Karnataka, sorry, just following on this increasing number of cases that we're seeing, it appears that some governments globally, especially in the case of the US and the UK, and the statements that we're seeing from the political leaders there, they seem to be toying with this idea that herd immunity can develop, and that will stop the further spread of the virus. Is this a feasible sort of concept that people should be looking at, or is it a very dangerous sort of myth?
Okay, yeah. Again, for the benefit of other viewers, so let me explain what is meant by herd immunity. Herd immunity is when a disease happens, an infection happens, then our bodies develop a protection or the immunity against that through development of protective antibodies. So when a certain number of people gets that disease, they slowly get immunity. Say if that number goes up to 80% or 90%, that means the others, the 10% who are in the community, or maybe 20%, they are protected because they are surrounded by those who have got immunity. But the pitfall here is immunity takes time to develop. When the infection happens, there is an immune reaction. All the symptoms of COVID is actually due to this immune reaction. But it takes time to develop those protective antibodies. It might take maybe 1 month or 2 months. So during that time period, if the spread happens in an uncontrollable manner, if you just allow the spread to go in an uncontrollable way, just because you want to develop herd immunity, you are asking for catastrophe, because you are
the healthcare system will collapse.
Because it doubles in an uncontrollable way, and within few cycles it engulfs the whole country. And that is, you can see that is happening where the countries where they don't have this strict control. But fortunately, thanks to Sri Lanka's government, the preventive health system, health workers, and the law enforcement and the country citizens, we are enforcing very strict controls. Therefore, actually it's under control. Comparably, we are having smaller numbers. So I don't think going only for herd immunity is a good idea. It will develop. Slowly it will develop.
But in the meantime, you have to deal with the problem.
You have to keep control. So the Sri Lanka strategy of keeping it under control, maybe till the vaccine develops in maybe 1 year's time, you never know. Maybe some antivirals develop. Again, you never know. Yeah. We have to keep this
on that sort of like medical professionals are looking at, researchers are looking at different ways by which to combat. And there's an interesting article on Bloomberg News today that in Australia, they're trialing BCG, the BCG vaccine, as a potential immunity booster. and that they'd be trialed among healthcare workers. Now, we know that we have a pretty strong immunization program in Sri Lanka, and we're given the BCG vaccine to fight TB when we're infants. Is there any sort of truth to this thing about BCG vaccine?
To be honest, I don't know. I mean, at the moment, there are a lot of trials going on. But then the problem is, Sri Lanka, the BCG cover is almost 100%. So then why are some of us are getting this disease? So there may be many reasons. The honest answer is, I don't know. I think the most important thing is we have a very good public health system. We have a good preventive system. Even the World Health Organization, they have identified the most important thing, most important aspect of controlling this disease is contact tracing and isolation. We have to break this vicious cycle. If the cycle is
adhere to the guidelines that are coming from the health.
Very clear guidelines are there. Go for the basic sanitation and make sure that you are immune, the nutrition, so on and so forth. Avoid going to crowded places. If you follow that, we should be able to break the cycle.
Dhananath, just before the program began, you would have seen former State Minister of Economic Affairs, Dr. Harsha De Silva, was talking about the potential for the Consolidated Fund to dry up by May. Is that a realistic prediction? Will the Consolidated Fund dry up by May?
I have done the calculations, but at an overall level, Majid, we are economically not in a good situation. Basically, to begin with, we had a bad start even before COVID issue came into Sri Lanka, because our growth rate was 2.6%, and we had a debt repayment commitment for about $8 billion in the coming 3 years. So anyway, we had a bad beginning. But forgetting all that, now there are a couple of cost factors coming in with the COVID. One is the increase in the healthcare expenditure, which is necessary to fight COVID, that is on. And there will also be another cost factor for losing of the productivity during this period, because most of as you know, the factories are not working, so there's a productivity gap. And also there's another cost factor, which is because of the breakage of the global value chains. For instance, the garment apparel sector, most of their ingredients or raw materials are imported. So now since this epidemic started in China, now the global linkages has been not functioning as it was. So these are the cost factors, and of course Sri Lanka has to bear with it. And we also see the bond market today, almost most of the foreign investors want to leave the market. And
that's interesting. There was a issuance of I think Sri Lanka development bonds, 220 million, if I'm not mistaken, and it was heavily undersubscribed. I think the government was only able to raise about $20 million. When was the last time that a bond issuance has been so heavily undersubscribed?
I can't recall the exact date, but it was for sure in our feasible memory. It was sometime many years ago. So that's why I said the financial outlook was not looking good. So I think from people's point of view, we have to get prepared, psychologically prepared for the somewhat darker days that is coming with higher unemployment, with getting ready to wage cuts, and maybe working harder to cover what we lost.
Staying on the economic side, we've seen that as a result of the COVID-19 pandemic, commodity prices have been driven down, especially in the case of oil. And the Sri Lankan government has taken a policy decision, however, that the price of fuel will not be reduced parallel to that global drop in oil prices. Is this the right decision?
In my personal opinion, this is the right decision, Majid. I know there's a conversation to passing that benefit to the people, but actually our balance sheet is very strict, because most of our imports are for importing of fuel, and at the moment fuel usage is slightly limited because the country is almost in a lockdown. So actually what we can do is take that advantage of dropping the oil prices in the world market by keeping a markup. Of course, I know it's not favorable for public, but anyway, even if you give that to the public, there is somehow you have to collect that money from the taxpayer.
So Dhananath, what do you suggest? Now you're saying that this money has to be used to cushion the country's balance sheet. Why not use it to strengthen the rupee against the US dollar? Is that an option?
That is an option. That is in a way an option. But when you give that, when you pass it to for the general public, and there will be a bigger outflow.
But you know that the tea industry in Sri Lanka accounts to 7% of the GDP. The tourism sector stands at 20% as far as the GDP is concerned. So the depreciation of the rupee against the US dollar is a big concern, despite the fact that tea exporters export, and it may sound or look as it's favorable for exporters when the dollar is high. However, most of the companies in Sri Lanka are borrowing in US dollar terms. And me coming from a tea industry background, the losses incurred by companies like us is quite huge in a situation like this. But we still continue to operate. So isn't it better to use that money to strengthen the rupee against the US dollar and make sure that you have a good industry to rely on subsequent to this COVID-19 or post-COVID-19?
Actually, when you keep the oil prices as it is, that is what is happening. Because if you bring the oil prices down, there will be higher consumption and there will be higher importation. But again, there's a myth that, of course, there's a side when you have more outflows that has pressure on the rupee. But actually, why the rupee has dropped is not because of that. It is because of printing the money. That's why in my initial round, I said government should not do three things. One is printing money, because there were a 50 billion cash injection, and there was a profit transfer from the central bank, and there was a statutory reserve rate drop, or a interest rate has been brought down. So when you bring the interest rates down, there's a cash liquidity coming into the market. Other than that, the central bank has given another 50 billion liquidity. So that is why the dollar is dropping. That is one reason out of many other reasons. So that's why I said if you keep the prices as it is on the oil market, of course there will be a demand drop, and that will help to sustain the currency.
So we have a question to Dr. Samantanand, the spokesperson of the GMOA, from one of our viewers. So the question is, what is the point of having a military-style lockdown? Is the government hiding something from the people? Has this spread to the community at large?
No, not really. Like, this the lockdown mechanism is I mean, it is being tested in other countries. So based on those international evidences, the lockdown system came into. Although the Sri Lanka is not 100% lockdown, we are maintaining certain type of to reduce the public movements, to lessen the associations between people, to keep this public distancing as much as higher. We have introduced this so-called police curfew. We don't use lockdown in Sri Lanka. It's called police curfew for some reason. So, however, the whole idea behind that is to maintain the social distancing, right? So, at least if we can make it to 80% of social distancing, it says that the evidence says that will itself help to control the disease. If I can
yes please,
photos that I have, like now what is happening now, if you don't do this this lockdown or the curfew system, what will happen people will move from one area to other area freely. So suppose a person who has a disease live in Negombo and he moves to Colombo, he will be taking the disease, like the transmission of the disease is highly possible. So therefore the curfew is imposed to control these movements, right? So that people will not take the disease from one area to another area. But what is currently happening is they have identified the red zones like Putlam, Negombo, the Gampaha district, Colombo and the Kalutara as a
Jaffna and Kandy as well now.
Now the Kandy and the Jaffna area has come. So now they are applying the curfew to that huge area. So by that, the people will be moving only in one district at the moment. They are not allowing people to cross one district to another. So the movements will be restricted only to a district, right? But now it's time to think about the restricting the movements within the district as well. You know, we can go, I'll show you quickly. Now if you take Colombo district, this is a suggestion, you know, you can, it is open to develop further or discuss further. Now for example, this is the Colombo, the map of the Colombo district. So if you can have a mechanism, this is not a difficult mechanism, to open area wise. These are the district divisional areas. If you open area wise, making people to restrict their movements from area to area. These are the areas that I took it as opening areas, and these areas will be locked down, so that people cannot move from this area to this area, right, to this area. So therefore, within the district, the whole idea what I want to say is that we should make the restriction within the area as well, so that the spreading can be minimized. That is what has happened in
Dr. Sajivana Amar Singh, Secretary to the Sri Lanka College of Psychiatrists. Now, anxiety is a major concern right now, because when someone gets a cold, he fears it's COVID-19. When someone gets a sore throat, he fears it's COVID-19. So anxiety plays a big role right now in Sri Lanka in terms of COVID-19. So what is your suggestion to those staying at home and who are worried about their health, who are worried about not being able to go to a doctor, to a private hospital because of the social stigma surrounding the virus itself, as Dr. Anand and even you said in your opening round? How can they manage anxiety?
Yeah, as I told you, certain amount of anxiety is inevitable in this situation and helpful as well, right? But being anxious about symptoms, and if you are worried about symptoms, I think there's a clear pathway by the government. There are telephone numbers available with which you can clarify. I think you need to get the facts. Do not go by social media. Do not go by myths. Get your facts correctly. Go to the either WHO website or the Ministry of Health website. Get information from reliable sources. And if you are worried about symptoms, you can call the given telephone number, and do not go to a doctor immediately. You can call a doctor, call the official number and get the information, right? And then act accordingly. Because this is a very tricky situation, because the symptoms of COVID-19 virus is very common symptoms. The symptoms you get are very common.
It's very similar to a bad flu.
That's right, it's very common. So I think at the moment, correct me if I'm wrong, there is no community spread at the moment. So it is isolated clusters, home clusters. So if you do not have a contact history, at the moment, I don't think you need to be panic immediately, you get a cold. But definitely you can call a doctor, call the assigned number and get the information. So that is what I would suggest.
Dr. Amar Singh, you were also talking about in your opening round the importance of providing counseling and listening to healthcare workers, people on the front line.
Yeah.
We've seen reports in the past of nursing staff and attendants at hospitals being asked by their landlords and landladies to leave their boarding rooms. There've been healthcare workers are being pretty much stretched, working double shifts, etc. Doctors, nurses, everyone. What kind of support mechanism can the government put in place, incorporating our resources of psychologists, psychiatrists and counselors?
Yes, in this situation we can actually learn from the Chinese experience, and in fact there's a very recent paper in the well-known medical journal Lancet about the mental health how they handle the mental health situation in Chinese frontline health workers. In fact, when they offered counseling, initially they got a negative response from the health workers, and then they inquired into it. And what were their main worries? One was they worried about getting infection. They were worried whether they had enough protective equipment. Second worry was whether they would infect their families. The third difficulty that they said was coping with patients who are not cooperating, right? And also lack of rest and recreation. So instead of directly going for counseling, then the Chinese authorities, they had in that particular hospital where the study was done, they created space. They created restroom for the staff, adequate restroom, and they provided accommodation within the hospital. And secondly, they had a clear guideline on protective equipment or protective gear to prevent. Thirdly, they in fact introduced video conferencing, calling, where they can actually keep in touch with the family members. So these moves actually reduced the anxiety to a great level. And they did, what they did was during this resting period, they introduced counselors where they would come and talk to the workers. So I would say that in Sri Lanka too, I would say the biggest anxiety among the healthcare workers is, are they being protected enough, right? Do they have enough rest? Will they infect their families, right? And those are the main concerns we need to address, right? And those are the causes for the anxiety. And also this person accommodation, which I think we need to address that. Maybe we need to provide them accommodation within the hospital, or the hospital has to get accommodation for them, because it's difficult to change the public perception immediately.
Dr. Anand, as the main union for doctors in the country, let's say, is the Government Medical Officers Association in touch with the health authorities and the government itself to safeguard the welfare of medical professionals using some of the strategies that Dr. Amar Singh was talking about?
Yeah, of course. Like, we are the Government Medical Officers Association, and our membership is the one who is in the front line. So it's our prime duty to protect our membership. I mean, without our membership, it's our duty, right? So therefore, we have taken certain strategies to face this situation, taking care of the public as well as to take care of our membership as well. They are doctors, of course. Not only the doctors, as we leaders in the health sector, we have to take care of our other staff as well. So therefore, now all this time we are talking about the problems, issues that we have. But mind you, Sri Lanka is a very lucky country where we have a very intelligent people with courage. So all those problems, if you go to the initial period of this virus, corona, COVID-19 case, we had millions of problems. There are certain problems that we could not imagine how to solve. That why I said that was, one time we had a problem of this PPE, so-called protective equipments, the gown and the goggles and other things. So when we tried to import them from the international market, it is not available, and the ports were closed, and so many other problems, and it is directly affecting to the healthcare workers' safety. So the Sri Lanka started manufacturing. You see, we got hold of a doctor from a consultant pediatrician in Anuradhapura. He came with innovative ideas, and there was a waste, clinical waste bags, and he found out that it can be used to produce PPEs, and now it is being produced, and believe me, the USA is asking for the product because they are in a need of PPEs at the moment. So through the proper channels it was requested. And the ventilators, if you take. Now people are trying to develop manufacture ventilators in Sri Lanka. So therefore, likewise, we have taken certain measures by ourselves, involving us with the innovation new ideas to develop certain things to protect our.
Thank you, Dr. Anand. Dhananath, this will be a controversial question.
With your permission, we'll come back to Dhananath with regard to the country's economy, but let's pose a question to Professor Indika Ranathrika, President of the Sri Lanka Medical Association. Professor, right now there is talk about Japan being introducing a antiviral oral medication called Avigan for individuals who are infected with COVID-19, and steps are being taken by the government to bring down this medication as well. How successful would this be? Because we know during the news, Dr. Samantha said that no clinical trials have been conducted on this as yet. And for a clinical trial to be conducted, it takes at least a year to bring about a medicine if it's to be successful. So what is the way forward for Sri Lanka and even the world for that matter?
Yeah. Again, I think there are many trials that is taking place all over the world, not only related to this drug, which is under the trade name of Avigan. There are many other antivirals that have been tried as well, but they actually take rather long time because we have to test the efficacy, how efficient the drug is, and how safe. So all these processes, even if they are fast tracks, still they take time. Regarding Avigan, I also heard that there are certain measures to import Avigan to Sri Lanka. There are some research papers, but the current situation is some research papers are supportive, some are not supportive. So all in all, we have consulted some of the top experts who are in the front line of management of COVID-19 in Sri Lanka. In their opinion also, if I quote even Dr. Ananda Vijayvikram, who is basically the key person in managing this infection, the evidence at the moment is not conclusive.
So right now in the world over, most of the countries are on partial lockdowns. Supermarkets are open, pharmacies are open, but Sri Lanka is taking a different step altogether.
Yes.
Do you think this would be successful in the long run? Because people who want medication, they have no access to medication. We know there are a lot of issues with regard to obtaining medication. In fact, this evening, I called a private hospital in Sri Lanka to get some medication, and they said that they were out of stock. And I had to wait for another 2 weeks. If that is something very important to me, urgent to me, I would be minus that drug. So is this the way forward for us? It seems that at least pharmacies should be open, at least in a controlled mechanism. At least 1 or 2 pharmacies in a particular area should be open. There has to be certain supermarkets open, at least for people to get their essential needs, because people are running out of the stocks that they already have. And Colombo, Gampaha, Kalutara, Jaffna, and even Kandy are now known as red areas or the worst affected areas from COVID-19 so far.
I think you have given the answer to that question as well. It's a very good question, and the answer was also given in the same question. If I am to elaborate now, if you look at this situation, we are looking at least few months to control this situation. I mean, the best possible scenario may be at least say 2 incubation periods. We are talking about 1 month to maintain this strict control. However, having said that, strict control doesn't mean that we should be depriving people of their essentials. So the medical approach or the preventive approach of keeping crowd gatherings, minimizing crowd gatherings, and sanitation has to be compatible with how to address the needs of the people. So if we take the basic needs, say the food and the medicines, and for health professionals, in addition the transport and the security. So those things got to be compatible with this basic need of controlling, because if we don't control, we are going to go into catastrophe. And if we go into that catastrophe, no economic measure or no medical measure will be able to save us. So we need to control. At the same time, you need to have compatible measures. So that is where you have to really rethink, have mechanisms where you can prevent, you can provide the drugs and the essential maybe food items in a way that will not be compromising that basic need of minimizing crowd gathering, preventing crowd. So this is why you need to use the localized system, maybe the Grama Sevaka system, the PHM system, to identify the people who need drugs, and that has to be coordinated with the hospital, so that there has to be some mechanism where the hospital can issue the prescriptions. It may be WhatsApp, but not everyone can use WhatsApp. So you need to go for different mechanisms. That is where you need a coordinated mechanism where the hospital system, the hospital MOs, and the PHI or the MOH and the Grama Niladhari getting together and have a localized system within that area. and maybe identify some identified pharmacies to make sure that the drugs are delivered. At the same time, you can use technology. WhatsApp is fine, but not everyone will be able to use WhatsApp.
Dr. Sanjeevan, issues are there in terms of people staying at home, and the worst affected people have neglected one aspect, that is the future prospects of this island, that is the children. They are being worstly affected by COVID-19 by staying at home. It's not a normal, usual break that they can go out and play and have fun, be with their families, probably go out on a picnic or even a trip for that matter. So children are also worstly affected by COVID-19, isn't it?
Yes, I mean, the children have lost their daily routine and they're at home, they're missing their school and extracurricular activities. So, but it seems inevitable for at least for the next 4 weeks. Yeah. So how do we make the best out of this situation? One thing that I suggest is you'll have to structure the day to some extent, right? And the children might spend, we'll have to give some limitation. The children might spend the whole day on video games or phones or TV. We should stop that and structure the day, right? And we should give them some time to study, right? And allocate time to study. And also, it's also a good opportunity. Yeah, it's a very good opportunity for parents and children to interact. And maybe parents can interact more with the children. And maybe they can get them involved in household work, in gardening, or even certain indoor games. So we need to create a little bit of a structure for the children. It depends on the child's age. It depends on which we can't. So depending on the child's age, you create a little bit of structure so they can study for a certain time, play at a given time, right? And creatively, we create some forms of relaxation for them also. I think we also need to be aware that children might get anxious and irritable when they're stressed up. They may not come and tell you that they're stressed up. So they may get irritable, they may throw temper tantrums, so they might...
So what can parents do in a situation like that?
That's what I've said. In addition to preventive measures, if you find the child is becoming more anxious, throwing tantrums, and in that situation, I know it's very difficult to find a psychiatrist or a counselor at this given time, but we do have a counseling hotline. We do have a counseling hotline at the National Institute of Mental Health. We do have the 1926, the short code.
So it's 1926.
1926.
1926.
1926. And not only for children, for adults, or even for victims of domestic violence. If you do, because it's not going to be easy to meet a counselor at this given time. So that hotline is on 24 hours, and there are trained nurses manning the hotline, doctors are on call. So in that situation, this is one option where parents can get advice.
Dharana, this is in reference to the things that you said the government shouldn't do. Recently, you would have seen a lot of outrage amongst the public, which is directed at specific companies over price gouging practices and allegations of profiteering. And in this backdrop, you said the government should refrain from imposing price controls. Would you care to explain that position?
Yeah. Nadeem, of course, government did the price control with a good intention, but the result was a bad consequence. Let me explain it in this way. Now, the canned fish was asked to sell at 100 rupees. If you look at the tariff structure, there's a 35% import tariff on tin fish. So if I am an importer, I have to pay 35% tariff on importing, and I have to take the risk of selling it at only 100 rupees. So for me, there is no incentive to sell it, even at the cost, because the week before, according to the government statistics from the census, if you look at the price of a 125 gram tin fish, it was priced at 225. So you are almost asking to sell it at half the price. So what happened? The general reaction is you are not selling the market, and if I am an importer, I am not importing the market. So what the next consequence is there will be no tin fish in the market. That is what exactly happened. I called the government given number to order the groceries. I asked, do you have tin fish? No. Do you have dal? No. That is, so the impact is, of course, it's good. It's with good intention. I really appreciate it. But the bad consequence is all the stocks are wiping out from the market. And who impacts it the most?
But then how can you prevent practices like price gouging and profiteering without price controls?
You have to have the competition, because when you take the price control off, of course there will be, I'm not saying then the tin fish prices will come down to 100. It will be at 225, at maybe 300. But when you look at the poverty statistics, it's not like everyone couldn't afford a 225. So at least you are opening the channel for those who are affordable to buy tin fish. So even if I am really poor, if I am not affordable 225, I have the option of moving to something else. But now what you are doing is you are creating an additional demand. Most probably I was able to afford to eat chicken. Now I am moving to buy the tin fish. So what happens, instead of poor man who can only afford 225 is now coming, who is losing the opportunity of buying the tin fish of maybe 200 rupees or 175 rupees instead of trying to sell it at 100 rupees. And that is what has happened. And that is why you see, if you try, I'm sure there will be available, and it creates also black market. And my mom had bought a pack of groceries, and there's a tin fish, but what has happened is they have been sold an entire pack for 500 rupees. So that includes salmon and sugar and few. So actually you can't identify whether the tin fish is sold at 100 rupees. So that is how
because it's part of the pack.
Part of the pack. So that is what happening in the market when you impose price controls. That's why I said government may have done it with a good intention, but the consequences were not as expected.
So in that sense, from the point of view of the consumer, now there is all sorts of WhatsApp messages and information, go to this side, go to that side, call this person. There are lists of hundreds of different contacts if you want to obtain your goods. So from the public's point of view, how do you make sense of all this? Because as people are spending absurd amount of time on their phone, making phone calls, searching, sending WhatsApps, and they're up all night. And then they find that, sites are no longer active. So from the public point of view, they are desperate, they need goods. So what do you say to them? How do they work their way through this and yet obtain their goods?
There are two sides. One is from the government side, there has to be more, you have to allow, for instance, if it's a tin fish, if I take it as an example, you have to bring that tariff down from 35% in this crisis situation. So then there will be more imports. From the public point of view, I think it's again rather public has a responsibility. I mean, if the goods are not available, I really don't know how to manage it on the public perspective. But what we could do is also, I agree with the medical expertise on we have to control the mobility of the people, but maybe we have to think of options. For an instance, for elderly people, if there's an hour where the supermarkets can be open, because I know a person who has an autistic kid and they both are 60 plus. And so since 60 plus, you have the general fear of going out anyway, even if the off curfew hours, and you really can't have the medication for your autistic kid. So what is your solution? So at least if we can have like a mechanism, again, given respecting to the medical advice, if you are not allowing them to travel from one city to the other, or even it's very contained, but you allow the banks to, for elderly people to use it for 1 hour, or you really have a mechanism where you open the markets in the sense you allow them to operate. And I had a chat with the tea industry exporters chairman, if I'm not mistaken. What he said was, we have a massive demand in the tea sector because 1/3 of the global population is sitting at home, and I think there's also a misperception that the tea is good for COVID-19. So there's a bigger demand, but our people can't work, and I really don't know how to export because the supply chains have been broken. So I think these things have to be considered in a public policy perspective.
Thank you, Dannath. Dr. Anand, just very quickly, Dannath was talking about, you were talking earlier about, controlling movement in specific areas, like even more localized than among districts. Is it a possibility, like what Dannath was saying, where you have, maybe for specific neighborhoods, you'll have specific times of the day where people can go to certain shops or certain, like say, bank branches to ensure that they're able to get things done.
Yeah.
Is that even like public services like garbage collection? Because you allow garbage to pile up and that will lead to another public health crisis. Is there something that can be sort of modeled or that can be experimented with?
Yeah, I thank you for the question, specifically because you connected me with Dhananath, because I have some inputs. What he expressed, I am not counter arguing with him. But now if you really take about this economic consequences, now if you think little laterally, in a different angle about these economic consequences what we face today. Now you see we spend 88 billion rupees per annum for importing drugs, and thanks to this coronavirus there are positive sides also. Thanks to this coronavirus, we understood that SPMC, the local drug manufacturer, has the capacity of increasing the manufacturing of drugs to 2,000, from 2,500 millions to 3,500 million. So we had that capacity, but it was not used. Since we had problems of importing drugs, now that production line has been started, right? So the amount that we spend to import drugs, the money which we are sending outside the country is being saved inside the country. And we are spending 55 billion, if I am not wrong, nearly 55 billion rupees per annum for importing the milk powder. Now if you really take, do we really need to bring the milk powder from other countries where we have so many other alternatives in the country? Like we talk about what to eat, and why don't we think of promoting the kanj, the kanda and other things that we can easily have in Sri Lanka, which are more nutritious as well in compared to the milk powder. And now see how much the millions of money billions of course of money we spend for this fertilizers, insecticides and all these things that we use for agriculture. But of course we had a very good agricultural practice before these multinational companies invade us and put this pressure, so-called perceptions, the myths, those are the myths actually speaking, that without fertilizers, without those chemicals, we can't do the agriculturing in Sri Lanka. They talk about the yield, but actually we can show the figures, the scientific figures. The yield without using these fertilizers are much more higher than the yields that we get with using the fertilizers, because we have our traditional rice varieties where the production is much more higher than the hybrid ones, So I think
Anand, my specific question was on opening up specific neighborhoods so that people can.
I'll come to that. I'll come. Give me 2 minutes. Because so when you take all these things, I'll summarize. What we have enough things. We have enough things inside, Don't talk about the tin of salmon. Now we are arguing the price of the salmon, whether it is 100 rupees, whether it is 150 rupees, whether the importer is getting affected or the consumer is getting affected. When we have enough things to replace the salmon, the sardine tin, and why are we worrying about this sardine tin? I can't understand. You go to the village, we have enough food. Varieties of food.
But Dr. Samantha, you would agree that if not for the GMOA, who acted as a pressure group, the government would not have imposed curfew. And if they clamped down on arrivals at least 3 weeks before, this situation would have improved. And there wouldn't have been any cases of COVID-19, and we would have been in a safe environment. And this is one of the questions posed to us as well today on the show, saying the government should have clamped down on arrivals at least minimum 3 weeks before instead of having nominations. Do you agree?
Yeah, well, that time there was, we still can remember, like there was a time that we had to put the maximum pressure to the government.
Yeah.
Like they had this, they were arguing at a point to say that, we have to take care of the people's daily living. And there was a, I don't know whether it is a hidden agenda or not. As you said, this nomination scenario was happening at the moment, at that time, of course. So, however, we thank the government, at least with a small delay, they could go to this lockdown or the curfew situation, where we minimize this.
No, but even, so the question was, I think Dhananath would agree, and even Nadeem, this control prices was also brought in as a method of winning the hearts of the masses, but not as a strategy per se, because we knew when the president made that statement, there was no curfew being imposed. It came just 1 day prior, and only a day after curfew was imposed. So the government was thinking, if they give a canned fish at 100 rupees and also dal at 100 rupees, things would be hunky-dory and they can win an election. Dr. Samant, I don't know whether you'll agree or not.
Yeah, well, it's a bit of political.
So today we are not going to talk about politics, so I'm going to leave that question at that. I want to pose a question to Dr. Sajeevan Amarasinghe. Doctor, social stigma, this is one of a very contention issues that we have to discuss with regard to where we are standing at the moment. Social stigma against people being truthful for the betterment of the nation, because we are a country that ended a war. We were not acting like cowards. We were a resilient nation. We went through a tsunami in 2004. We came back with a bang, and the country was ended a war in 2009. So we were in the right footing at that time. But what is the social stigma that we're talking about?
Yeah, now what has happened now is actually it's quite understandable sometimes in the public's point of view. If somebody gets COVID-19, if a given person gets COVID-19, his family gets quarantined, and people are scared. And now it has come to a situation, and of course I don't think his name is given out, but details are given out in the media.
If you look at it, these houses, there is a post that is being put before these houses. So anyway, people get to know about them.
That's right. So it's a tool.
Why not make it a wider public engagement, as Dr. Samantha said? It's important that people to know who this person is. Now, for an example, I can give you a classic example. Nadeem. I knew that Nadeem had gone for the Royal Thomil match, and we didn't get him on the show for 2 weeks at a stretch, because we knew that he was in the Royal Thomil match, and we did not want to be exposed to him.
Yeah, so you need to balance the confidentiality with the public good. And in this situation, with the situation with like Boris Johnson or Prince Charles, they told it themselves. They voluntarily came and told. And in fact, that would have had a positive effect. And probably would have other people also would come and tell, okay, I'm also having the illness. So in Sri Lanka, we haven't got people coming publicly, but we have got the media exposing it. So in that situation, there is a bit of a issue, because I'm fearing that this might create a it might actually backfire. In the sense, now we have seen several patients who don't actually reveal their travel history. Now we had a patient in Ragama, we had a patient in Colombo, and now we had a patient in Javadanapura, and now there's a patient in Nigambu. They come to the hospital, they have a travel history, they have a contact history, they don't tell that. And the result is, the doctors don't know, the doctors treat them as an ordinary patient, and when they finally get to know the patient is COVID positive, so many doctors and health staff have got affected. And then all the doctors have to get quarantined. And so this situation, I mean, it's very bad of that patient to do that, but we need to realize that sometimes the patient may be scared to tell that. And because of the consequences that will happen, he will get quarantined, his family is going to get quarantined, they are going to paste a poster in front of his house. So, and in situation, it's quite natural for the patient also to be on the back foot. And we should not look at the patient as an offender. And that's, I think, some of the, if you look at the social media, I mean, some people have made, few people have made mistakes, few have dodged quarantine, but the vast majority have not done that. So, and we should not look at the patient as an offender. He is actually a victim. He's a patient. And so that kind of attitude, not from the mainstream media, probably mainly the social media, and now we have got even religious labeling now. That has also come into it now. So it is a dangerous situation. So my fear is that that might lead to more and more patients not disclosing, and that will lead to health staff getting exposed. So we need to have a balance here. We need to have a balance. We need to respect the confidentiality. We also need to look at the public health aspect. I feel our public health system, if you find a given patient in a given patient, the public health system is quite strong enough to find out the contacts. And the police and the public health system are quite competent to find out the contacts. And I don't think it's necessary to give the name into the media unless there are exceptional circumstances. Maybe there's an exceptional circumstances. Man has not divulged, he's had contact, not divulged, had symptoms, gone around the country, infected so many people, so the public health system can't cope. There you might have to give the name to the media and say, okay, all those who have come into contact with this particular person, maybe like it was at the Royal Dominion, right? So you may have to give it out.
Right. Professor Karunathilaka, before we go in for a short commercial break, tell us, in a situation of this sort, how bad is this quarantine process at IDH or even at any government hospitals? If you can tell us, is it bad as people think it is?
No. Actually, quarantine is an essential process. It's one of the approaches that you need to contain or curtail this situation. And quarantine actually happens in specialized camps, and they are very well managed by the Sri Lanka Army and the Tri-Forces. What happens in quarantine is, it's not like many people believe that people are taken from the airport or from their residences, they are taken into a bus and put into a camp, a common area. It's not like that. People are basically categorized according to their risk situation. So people or say suspected individuals who are from say certain countries, they are categorized together, and who are from low risk areas, they are categorized together, and they are looked after, and they are looked after for the incubation period of 2 weeks, and after that they are released. So in this way, it's a very successful process, because the most important thing is you need to break this cycle.
Thank you very much, Professor, for joining us this evening. We go in for a short commercial break. Stay connected, stay with News First. When we come back, it's the final round. We discuss more on COVID-19 and what steps you should take at home to prevent and make sure that you stop the spread and stay alive. Stay connected, stay with Face the Nation. We will be right back. Welcome back. This is Face the Nation. We are discussing about COVID-19, the final round. We start off with Dhananath Fernando, Chief Operating Officer of Advocata Institute. Dhananath, the President made a request from the World Bank as well as the IMF not to charge money, or not to, for them not to get interest payments from countries like Sri Lanka in light of COVID-19, because there is an economic issue overall which is entangled as far as COVID-19 is concerned. World Bank and IMF, what do you think they should do, and what is your suggestion in terms of COVID-19, and what must we do now? What are the ideas that you have in mind?
Yeah, in terms of President's appeal or requesting from the IMF and the World Bank, I think it is very timely, and he has done the right thing, because of course we have to negotiate. We are already in an IMF program, and I think we have to extend it to the sovereign bond payments that we have to do. We have to renegotiate with other parties as well on rescheduling our debt, because it looks very tight, to be very honest, because $8 billion in 3 years, $8 billion US dollars in 3 years is an enormous big amount, and it is too much for an economy like ours. And adding that, there will be more cost incurring, and there will be more productivity loss given this side. And in the same time, what are the ideas that I would like to propose is, Sri Lanka has, in terms of this debt repayment and bringing foreign currency, there are limited tools that we can use at this particular moment. One is we can raise it again, going to the international market with a bond issuance. But the climate is not right. As you can see, the bond market today was the last couple of weeks, the investors want to leave. So one option is again going back to IMF, because to overcome the situation, which is not my first recommendation, but it seems like we are running out of options. The other option is, again, as I said, we speak to the neighbors and the governments and ask for a government-to-government loan with no strings attached. We may be able to go back to China or India or other closer nations and ask their support at this particular moment, but no strings attached. That's the number 2 option. Number 3 option is, as I said, going back to IMF. But if you are going back to IMF, I think we have to be slightly faster. They have about 1 trillion donation or like a money pot now, but 80 countries are also reaching them at this particular moment. So I think if we are going back, I think that's the feasible option. In terms of, that's an option again, which is not, I would like to recommend, but if we are running out of options, that is like the fallback option.
Very quickly.
In terms of ideas and suggestions, we spoke about a stigma and whether people should get to know about whether who has been infected. Actually, South Korean example is a good example. They used a mobile app and you can mark if you know someone infected, or if I'm infected, my private details, I'm not sure whether they divulge information, but I mark that I was in Stein Studio and I am infected for COVID. So my friends and everyone got the information that I was in Stein Studio and calculate with the date. So that's a mobile app the South Korean used. So we may be able to maybe consider that option. And in moving forward, what we could do is, hopefully after this COVID wave is gone, I think we have to cover the productivity loss. So one option is we can declare a 6-day working week. This is just a suggestion, because we need to cover that up. And of course, we will not be able to cover everything. Again, this is after the COVID wave is gone. The other option is, of course, we all know this is not the popular suggestion. We all know this year is full of long weekends. So we may be able, we may to consider like the religious holidays we give them to observe their religion for a couple of hours, and maybe reconsider to cover up for what we lost. So those are the ideas that I would like to propose, since we all in a crisis and we are in the eye of the crisis, eye of the storm, and we all need ideas. So
thank you very much.
That's one. If I may comment on the price control argument, I'm just wrapping it up. It was not the comment made by me. I just took it as an example, and it's happened in the face mask, and it has happened in all over. So I just wanted to clarify that it's not my example. I just put it.
I don't think Dr. Samantha meant it
exactly.
In that way.
I'm not meaning either.
He's apolitical at the moment. So I now move to Dr. Sajivana Amarasinghe, Secretary of the Sri Lanka College of Psychiatrists. Dr. Sajivana, interestingly, what is the message you have for parents and also those who are staying at home who really want to go out now and probably have a cup of coffee outside, mingle with their friends, family, so on and so forth? What is the message you have for them?
I would tell them, we have to accept the inevitable. We have to accept the situation for what it is, and there are certain things that are beyond our control. And the country would be in the lockdown mode for the next 2 or 4 weeks. So a certain amount of anxiety is going to be inevitable. Certain amount of fear is inevitable, but we need to control it. Don't worry about things beyond our control. Try to make the best out of a bad situation. Don't spend too much time surfing or on searching about the epidemic. Control your time. Control the time that you spend looking for news about the epidemic. Instead, focus on your leisure activities. Try to do, I know within your house, maybe in the garden, if you can do some exercise, do a bit of gardening, all that would be good for your mental health. Try to structure your day as much as possible. Don't just, otherwise it becomes very difficult to spend the time. Try to spend more time with your children. Look at it positively. Start reading or spend time in your hobbies. And finally, I want to give a message to those on medication. There may be a lot of people on medication for mental illnesses at this time, and as he said, they may have difficulties in meeting their doctors, getting their medications. Now, government clinics have started a system where they will send the medications through post. So contact your clinics. If you are taking from the private sector, contact your doctor And also be aware that, please be aware now the private hospitals have started the telemedicine or audio kind of consultation or video consultation options are now being developed. So this may be the primary method for the next 3 or 4 weeks now. And especially for psychological problems, it's a viable option. So think of those options. And finally, we also have the hotline at the National Institute of Mental Health. If you're really feeling stressed out and you can't cope, the number is 1926. It's open 24 hours.
Thank you very much, Dr. Sajeev Namasinghe. We now move our attention to Professor Indika Karunatilaka, Sri Lanka Medical Association. He's the president. Professor, what is there any silver lining right now? We know that if there is an antiviral medication that has to come out, a successful antiviral medication, it takes at least close to a year. But is there any glimmer of hope or a silver lining in these dark clouds for Sri Lanka and even the world for that matter?
Of course I do. Because, I mean, at the moment it looks a long drawn out battle, that is true. Even if we reach a peak maybe in a few weeks and when the curve starts to go down, I think we need to learn to coexist with COVID rather than thinking about what will happen after COVID. Since this seems a long drawn out battle that might go on for maybe a few months, we have to be prepared to live with that. So that means we have to rewire and rethink our systems. Maybe the health system, for example, Sri Lanka Medical Association, we have started a free health advice system where the patients are connected with the doctors and they can get the advices. Like that, we have to think of new systems, say in health, how to deliver drugs, medicines, how to provide primary care. So we have to rethink in different ways. In education, how to go for maybe online education, virtual reality. In economics, how to go for maybe online kind of businesses and to think of maybe home economies, maybe the rural economies, all these things. We have to rethink and rewire ourselves. That's a matter of adaptation. But I think Sri Lanka can, because this is a country with a very strong public health system. Our clinicians and doctors are very strong and very capable. The government is ready to go any distance to control this. And the people are very intelligent, very knowledgeable. And the long forgotten Sri Lankan values, the honesty, truth-telling, simplicity. And now it's time to return to that. So I think Sri Lanka can.
Thank you very much, Professor Indika Karunatilaka. Sri Lanka, of course, can. Dr. Samantha Ananda, spokesperson of the GMOA. People are right now acting very responsibly, Dr. Samantha, and this may lead to even a complete lockdown in Sri Lanka. Do you foresee this happening in the next few weeks?
Yeah. Yeah. I'll start with Professor's thing. He finished his wording saying Sri Lanka can. And as a responsible person who involved in all these activities, I would like to say we will. We will overcome this COVID-19 problem. And so I just wanted to give the confidence to the public. We are going to take care of you all. Please, if you are sick, come to us. We are there to help you all. We are there to take care of you all. We are ready to take care of you all. So no fear should be there. No worry should be there. But only thing that we are asking, stay at home, make yourself without getting contaminated with this virus. Make sure that you take care of yourself. But in case if you are sick or something, please come to us. We are ready to take care of. And then on the other hand, to tell few things about the things that we discussed. Now the Agriculture Ministry has started a program called Saubhagya Gevatta. They are going to distribute seeds to do home gardening. GMOA also has collaborated to this. So we are giving you options. There are 5 million communities in Sri Lanka. So this will be given 1 million households can be will be distributed, so they can get engaged with this program where they can do home gardening with the family. You can spend the time. Anxiety, fear can be mitigated by these kind of activities. And for the patients, I have a strong message to give. Now, as he said that there are telemedicine things that are started in the private sector. I am happy to say that from Tuesday onwards, even in the government sectors, they are going to start the program of telemedicine program. Even the video conferencing can be done. The first will be started in the Lady Ridgeway Hospital, and from there onwards, we will be trying to spread it all over the countries, where the people can, discuss with their problems by staying at home rather than coming to the clinic. So with all these things, you asked me whether we are going for a complete lockdown. No, we will not be. We don't pray for that. We don't want complete lockdown. So the responsibility is in the public hands. So please help us. Stay at home. Help us. We will take care of you all.
Thank you very much, Dr. Samantha Ananda. Thank you very much, Professor Indi Karunathilaka, President of the Sri Lanka Medical Association, for joining us this evening, and also Dr. Samantha Ananda, a spokesperson of the Government Medical Officers Association, for being in the front line and treating the patients infected by COVID-19. Also, Dr. Sajivana Amarasinghe, Secretary of the Sri Lanka College of Psychiatrists, and also Dhananath Fernando, CEO of the Advocata Institute. Thank you very much, gentlemen, for joining us this evening on the show, despite having fears, despite the fact that you all should be staying at home and being in a lockdown, complete curfew in this curfew area. Thank you very much for joining us this evening to enlighten the public about the steps that they should take to mitigate this issue and also come out on top as far as COVID-19 is concerned. Thank you very much, Nadeem, and thank you very much, Shahan, for joining us this evening on the show. I leave you tonight with a quote, as I always do. Face your fear, accept your war,